Question number 1. World Health Organization WHO is headquartered in options A. Geneva, Switzerland, B. New York, USA, C. Paris, France, D. London, UK. And the correct answer is option A. Geneva, Switzerland. Question number 2. United Nations Children Fund, that is UNICEF, headquarters is in options A. Washington DC, USA, B. New York, USA, C. Geneva, Switzerland, D. London, UK. Option B. New York, USA is the correct answer. Question number 3. World Bank headquarters is located at options A. Geneva, Switzerland, B. Washington DC, USA, C. New York, USA, D. London, UK. Correct answer is option B. Washington DC, USA. Question number 4. The World Food Programme, that is WFP, has its headquarters in options A. Rome, Italy, B. Geneva, Switzerland, C. Vienna, Austria, D. New York, USA. Correct answer is option A. Rome, Italy. Question number 5. The Food and Agriculture Organization, that is FAO, has its headquarters in options A. Geneva, Switzerland, B. Rome, Italy, C. New York, USA, D. Berlin, Germany. Option B. Rome, Italy is the correct answer. Question number 6. The International Labour Organization, that is ILO, headquarters is in option A. London, UK, B. Geneva, Switzerland, C. Washington DC, USA, D. Paris, France. Option B. Geneva, Switzerland is correct answer. Question number 7. The UNAIDS headquarters is located in options A. Rome, Italy, B. Geneva, Switzerland, C. New York, USA, D. London, UK. Correct answer is option B. Geneva, Switzerland. Question number 8. The World Heart Federation, that is WHF, is headquartered in option A. Geneva, Switzerland, B. Brussels, Belgium, C. Paris, France, D. New Delhi, India. The correct answer is option A. Geneva, Switzerland. Question number 9. The World Federation for Medical Education, that is WFME, is headquartered in options A. London, UK, B. Fenny-Voltaire, France, C. Copenhagen, Denmark, D. Geneva, Switzerland. Option A. London, UK is the correct answer. Questions related to allergic skin test. Question number 10. The allergy test is commonly performed by which route of administration? Options A. Intramuscular, B. Subcutaneous, C. Intradermal, D. Intravenous. Correct answer is option C. Intradermal. The intradermal route introduces the allergens into the dermis where mast cells are abundant. Question number 11. The principle of the skin prick test is based on option A. Delayed hypersensitivity, B. Immediate hypersensitivity, that is type 1, C. Cytotoxic hypersensitivity, D. Immune complex hypersensitivity. The correct answer is option B. Immediate hypersensitivity, that is type 1. It detects preformed IgE antibodies that trigger mast cell degranulation and histamine release. Question number 12. The control used in a skin prick test is option A. Normal saline, that is negative control, option B. Histamine, that is positive control, option C. Both A and B, option D. Distilled water only. The correct answer is option C. Both A and B. Negative control, that is saline, it ensures no reaction occurs without allergen. Positive control, that is histamine, it confirms skin reactivity. Question number 13. The intradermal test is generally options A. More sensitive but less specific than the skin prick test, B. Less sensitive but more specific, C. Used for type 4 hypersensitivity, D. The first line allergy test. The correct answer is option A. more sensitive but less specific than the skin prick test. It can detect smaller amount of allergen sensitivity but has higher risk of false positive and systemic reactions. Question number 14. The patch test is used to detect options A. Type 1 hypersensitivity, option B. Type 2 hypersensitivity, option C. Type 3 hypersensitivity, and option D. Type 4 hypersensitivity. And the correct answer is option D. Type 4 hypersensitivity. The patch test diagnoses contact dermatitis, that is delayed type hypersensitivity. It's mediated by T cells, not IgE. Question number 15. The reaction time in a skin prick test is usually read after option A 5 minutes, option B 15 to 20 minutes, option C 1 hour, option D 48 hours. Option B 15 to 20 minutes is the correct answer. The wheal flare appears quickly within 15 to 20 minutes due to immediate histamine release. Question number 16. A positive skin prick test is indicated by options A. Necrosis, B. Itching only, C. wheal flare reaction, D. blister formation. Option C is the correct answer, wheal flare reaction. Local redness, that is flare, and swelling, that is will indicate histamine mediated allergic response. Question number 17. The patch test results are read after options A 15 minutes, B 2 to 4 hours, C 24 to 48 hours, D 5 to 10 days. The correct answer is option C 24 to 48 hours. It detects delayed hypersensitivity, so results develop over 1 to 2 days. The initial reading is usually done within 24 to 48 hours after patch removal, with additional readings to detect late reaction possibly extending to 7 days depending on the allergen and chemical context. Question number 18. The RAST, that is radioallergosorbent test, measures options A. Total IgG, B. Allergen specific IgE in serum, C. T cell response, D. Histamine release in skin. The correct answer is option B. Allergen specific IgE in serum. It's a blood test that quantifies IgE antibodies against specific allergens. Question number 19. The advantage of in vitro tests like RAST over skin test is options A. They are faster, B. They can be done even when antihistamines are used, C. They are more painful, D. They always give exact same result as skin test. Option B. They can be done even when antihistamines are used is the correct answer. Antihistamines interfere with the skin test results but not with the blood-based test like RAST. In vitro tests such as RAST measure allergen-specific IgE in the blood and are not affected by medications like antihistamines, which can suppress skin test reactions. They are safer for patients who have skin conditions, are unable to stop antihistamines, or when skin testing may provoke severe reactions. However, in vitro tests are generally more expensive, take longer to get results, and may be less sensitive than skin test. Question number 20. Which of the following is a contraindication for performing a skin prick test? Options A. Patient on corticosteroids, B. Patient on antihistamines, C. Pregnant woman, D. All of the above. The correct answer is option D. All of the above. Contraindications for performing a skin prick test include use of antihistamines as they suppress skin reactivity and affect results, pregnancy due to the rare risk of anaphylaxis with hypotension and uterine contractions, and diffuse dermatological conditions or severe dermatographism. Persistent, severe or unstable asthma, inability to cooperate, and use of beta blockers are also contraindications. Oral corticosteroids do not significantly affect test results, but extended use of topical corticosteroids at the test site may interfere. Therefore, all options listed are considered contraindications, with the strongest contraindication for antihistamine use due to its direct impact on test validity and pregnancy being a relative contraindications for safety reasons. Question number 21. The most serious complication of allergy skin testing is option A, local itching, option B, bruising at the site, option C, systemic anaphylaxis, option D, urticaria at test site. Correct answer is option C, systemic anaphylaxis. While local reactions such as itching, urticaria and bruising at the test site are common and generally mild, systemic anaphylaxis is a rare but potentially life-threatening complication. It involves multi-system allergic reactions including respiratory distress, hypotension and shock. Although extremely uncommon, risk less than 0.02% in skin prick testing, anaphylaxis requires immediate recognition and treatment during allergy testing. Question number 22. The size of the wheal in a positive skin prick test depends on options A, concentration of allergens, B, degree of sensitization of the patient, C, reactivity of the skin, D, all of the above. The correct answer is option D, all of the above. Multiple factors like allergen strength, patient's IgE level and skin reactivity, it affect the response size. Question number 23. Before performing an allergic skin test, antihistamine should be discontinued for at least option A, 6 hours, B, 12 hours, C, 48 to 72 hours, D, 1 week. The correct answer is option C, 48 to 72 hours. This time frame ensures that the antihistamines are sufficiently cleared from the body so they do not suppress the skin's allergic response, which could lead to false negative results. Some sources recommended withholding antihistamines for up to 5 to 7 days depending on the specific medication, but generally 48 to 72 hours is considered the minimum safe period for common antihistamines before testing. Question number 24. A negative skin test in a highly symptomatic patient may occur due to options A, poor quality allergen extract, B, antihistamine use, C, immunosuppression and option D, all of the above. The correct answer is option D, all of the above. That means poor quality allergen extract, antihistamine use, immunosuppression are the reasons. Question number 25. Which of the following cannot be detected by skin prick or intradermal test? Options A, pollen allergy, B, food allergy, C, contact dermatitis that is nickel, D, dust mite allergy. Option C, contact dermatitis that is nickel is the correct answer. The skin prick test that is SPT and intradermal test are used primarily to detect IgE mediated immediate type that is type 1 hypersensitivity reactions. These tests are effective for detecting allergies to pollen, food and dust mites, which are typical inhalants and food allergens. However, contact dermatitis caused by substances like nickel is a type 4 delayed hypersensitivity reaction mediated by T cell, not IgE. Contact dermatitis cannot be detected by skin prick or intradermal test. Instead, it requires patch testing, where allergens are applied to the skin under patches for an extended period and the skin reaction is observed later. Question number 26. The E-test, that is enzyme-linked immunosorbent assay ELISA based for allergy measures options A, serum IgE antibodies to specific allergens, B, mast cell histamine release, C, T cell proliferation, D, complement fixation. The correct answer is option A, serum IgE antibodies to specific allergens. The E-test is a non-radioactive alternative to RAST for measuring allergen-specific IgE. Question number 27. The immunological basis of a positive patch test is options A, IgE-mediated mast cell degranulation, B, complement activation, C, T cell mediated delayed hypersensitivity, D, immune complex deposition. The correct answer is option C, T-cell mediated delayed hypersensitivity. Question number 28. The time of onset of a type 1 allergic reaction after exposure is options A, 24 to 48 hours, B, 6 to 12 hours, C, within a minute, D, 3 to 5 days. The correct answer is option C, within a minute. Immediate hypersensitivity occurs rapidly due to preformed IgE antibodies and histamine release. Question number 29. Which of the following pairs is correctly matched with its hypersensitivity type? The options A, asthma type 2, B, serum sickness type 3, C, contact dermatitis type 1, D, hemolytic anemia type 4. The correct answer is option B, serum sickness type 3. Type 1 is anaphylaxis asthma, type 2 is cytotoxic, example hemolytic anemia, type 3 is immune complex, that is serum sickness, type 4 is delayed, example contact dermatitis. Question number 13. The total serum IgE level is elevated in options A, atopic allergy, option B, parasitic infection, option C, immunodeficiency, D, both A and B. The correct answer is option D, both A and B. High IgE levels are typical in allergic, that is atopic individuals and patients with parasitic infection. Question number 31. A normal serum IgE level in adults is approximately option A, less than 10 international unit per ml, option B, less than 100 international unit per ml, option C, less than 1000 international unit per ml, option D, less than 10,000 IU per ml. The correct answer is option B, less than 100 international unit per ml. Values above 100 international unit per ml often suggest atopy, parasitic infection or immunological disorders. Question number 32. The gold standard for confirming an allergy diagnosis is option A, skin prick test, option B, serum IgE test, option C, double-blind placebo-controlled food challenges, option D, RAST. The correct answer is option C, double-blind placebo-controlled food challenge. The double-blind placebo-controlled food challenge, that is DBPCFC, this test involves giving the patient progressively increasing amounts of the suspected allergen or a placebo without their knowledge and monitoring for allergic reactions under strict medical supervision. It is considered definitive for diagnosis IgE mediated food allergy. Question number 33. A patient with urticaria after taking penicillin shows positive intradermal test to penicillin. This represents option A, type 2 hypersensitivity, option B, type 3 hypersensitivity, option C, type 1 hypersensitivity, option D, type 4 hypersensitivity. And the correct answer is option C, type 1 hypersensitivity. Penicillin allergy commonly involves IgE mediated mast cell activation causing immediate reactions like hives and anaphylaxis. Question number 34. A food allergy causing delayed symptoms after 24 to 48 hours is most likely mediated by option A, IgE antibodies, option B, T lymphocytes, option C, complement system, option D, basophils. Option B, T lymphocytes is a correct answer. Question number 35. Which of the following medications should be available during an allergic skin test? Options A, atropine, B, epinephrine, C, lidocaine, option D, hydrocortisone ointment. The correct answer is option B, epinephrine. Question number 36. The nurse observes that a patient develops eczema and diarrhea 48 hours after eating a certain food. This suggests option A, type 1 hypersensitivity, option B, type 2 hypersensitivity, option C, type 3 hypersensitivity, option D, type 4 hypersensitivity. The correct answer is option D, type 4 hypersensitivity. Delayed symptoms appearing 1 to 2 days later indicates a cell-mediated, that is T cell reaction, that is type 4 hypersensitivity. Question number 37. A patient scheduled for an allergic test reports taking diphenhydramine, that is Benadryl, yesterday. The nurse should options A. Proceed as planned, B. Continue test but increase allergen dose, C. Reschedule the test, D. Give antihistamine again before the test. The correct answer is option C. Reschedule the test. Antihistamines must be stopped at least 3 to 5 days before testing to prevent false negative results. Question number 38. The nurse explains to the patient that a negative allergy skin test means option A. The patient has no allergies. Option B. The patient may still have allergies undetected by the test. Option C. The immune system is suppressed. Option D. The allergens were inactive. The correct answer is option B. The patient may still have allergies undetected by the test. Skin allergy tests are not always 100% accurate, and some allergies may not show a response due to various reasons such as medications interference, low reactivity, or other types of allergies not detected by the specific test used. False negative results can occur, and not all patients are allergic only to what is detected in these tests. Question number 39. Foods commonly associated with the delayed allergic reactions include option A. Peanut and shellfish. Option B. Milk, soy and gluten. Option C. Strawberry and eggs. Option D. Chocolates, citrus fruits. The correct answer is option B. Milk, soy and gluten. Cow milk protein, soy and gluten are known to trigger delayed T cell mediated food allergies, especially in infants. Question number 40. During patient education, the nurse should emphasize that food intolerance differs from food allergy because option A. Intolerance involves the immune system. Option B. Allergy involves immune reactions. Intolerance does not. Option C. Intolerance causes hives and swelling. Option D. Both are the same. The correct answer is option B. Allergy involves immune reactions. Intolerance does not. Food allergy is an immune system response where the body reacts to a food protein as harmful, causing symptoms like hives, swellings, or even life-threatening anaphylaxis. In contrast, food intolerance does not involve the immune system but usually involves digestive system issues and enzyme deficiencies leading to symptoms such as nausea, gas, cramps or diarrhea.
If you are preparing for any nursing competitive exam and you want more MCQs and quick revision videos like this, make sure you like, share, and subscribe to Steps to Scrubs. Stay tuned for more useful content, and until the next video, bye and take care.